so I've washed my hands, I've donned the appropriate PPE. My name is Jake, I'll be your nurse for the evening. I'm going to be providing your physical assessment. I've ensured that we have a private space available for our physical assessment as well. Can I see your wristband? Okay, can you give me your name and date of birth?
Kana Kalaga, April 24th, 2001.
Okay, do you know where you are?
The hospital,
Do you know what year it is?
2021.
And do you know what you're here for?
A physical assessment.
Okay, awesome. How are you feeling?
Feeling alright?
Okay, patient appears calm. You walked in, so you were able to walk without any sort of assistive device. You had a steady gait. Posture appears upright. Alrighty, so I think we can begin. I'm going to have you raise your arms for me. I'm just going to assess your arms real quick. So arms appear symmetrical, no deformities present. I'm just going to feel them real quick for any tenderness or pain. You just let me know if you feel anything. Okay, good. No pain noted. No tenderness noted, no deformities noted as well. You can go ahead and relax your arms a little bit. I'm going to have you flip your wrists out for me. Arms were also warm to touch. I'm going to feel for your radial pulse now. Radial pulse present, +2, regular, bilaterally. I'm going to feel for your brachial pulse now, so you can go ahead and lower your arms a little bit. Brachial pulse present, +2, regular, bilaterally. Okay, I'm going to have you raise your arms again. I'm going to feel the back of your arms for any lymph nodes. You let me know if you have any tenderness, pain. Okay, no prominent nodes, no pain noted. Okay, you can go ahead and raise your hands for me. Let's take a quick inspection. Skin color appears appropriate for race. Skin is intact. Yeah, good. So I'm going to feel your hands really quick. No excess moisture either. Check for capillary refill. Capillary refill, less than 3 seconds bilaterally. Okay, if you want to raise your hands to me, I'm going to have you make a little heart. Okay, and no clubbing noted. Alrighty, so now we're going to begin the chest assessment. So if you take off your shirt for me, and then turn around in the chair as well. Okay, looking at the back now, shoulders appear equally placed and symmetrical. Thoracic muscles look well developed. Scapular also symmetrical. Posture is upright. Breathing is unlabored and rhythmic. Skin is intact. Skin color appropriate for race. Okay, I'm going to feel along your back now. Let me know if you feel any pain or tenderness, okay? Okay, thoracic muscles well developed. I'm going to put my hands against your back. You go ahead and take a deep breath now. Chest expansion is equal. So I'm going to put my hands on your back again. Every time I put my hands on your back, I'm going to have you say 99, okay?
99, 99, 99, 99.
Okay, vibrations felt equally. Alrighty, and now I'm going to listen for any lung sounds, okay? So every time I press with my stethoscope, I'm going to have you go ahead and take a deep breath for me, alright? Actually, before I do that, I'm going to assess you for any costovertebral angle pain. So I'm going to just hit you on your flank. You let me know if you have any pain or tenderness. Okay, no pain or tenderness noted. Now I'm going to start listening with my stethoscope. Once again, breathe in through your mouth. Okay, posterior chest clear to auscultation. I'm going to have you cross your arms over your shoulders now. I'm just going to put my stethoscope on your sides. So, same thing as before, in through the mouth. Okay, sides of the chest clear to auscultation. You can go ahead and turn around in the chair now. I'm just going to inspect your chest really quick. Chest muscles look well developed and symmetrical. Skin color appropriate for race. Skin is intact, no lesions noted. Okay, I'm just going to palpate your chest really quick. Let me know if you have any tenderness or pain. Okay, it's all good. Alrighty, I'm going to listen for any lung sounds once again. Also, no pulsations or heaving noted on respiration. Respirations appear rhythmic, unlabored as well. So, once again, same thing as before. You're going to take a deep breath through your mouth every time I press my stethoscope. Okay, anterior chest clear to auscultation. Now what I'm going to do is listen to your heart. I'm just going to ask you to breathe normally. You don't have to take any deep breaths for this one. So we're going to find the angle of Louis. And from there, second intercostal space, starting with the aorta, pulmonary valve, Erb's point, tricuspid valve, and then moving on to the mitral. Okay, and from here, I'm going to listen to your heart rate for 1 minute. Alrighty, be about 72 beats per minute. Regular rhythm, S1 and S2 were heard, no S3 or S4 heard, no murmurs or adventitious sounds present. So you can go ahead and put your shirt back on, and I'm going to ask you to lie down on the couch. We'll begin your abdominal assessment in just a moment here. And so for your abdominal assessment, what I'm going to do is have you just kind of raise your shirt up here. Go ahead and lie down. I'm going to take a quick look at your abdomen. Okay, so we'll raise this up here. Alrighty, skin appears intact, mild freckling present, no deformities, no bulges on inspection, no prominent veins either, no peristalsis or pulsations present either from what I can see. So you can go ahead and raise your head a little bit. I don't see anything bulging around the navel or any hernias present. Go ahead and lie back down. I'm going to go ahead and listen for any bowel sounds really quick. Okay, bowel sounds present in all 4 quadrants. I'm now going to listen for any bruits in your arteries, starting with the aorta. Going to the right renal, left renal, left iliac, and right iliac. I would also check both femoral arteries, no bruits present. So I'm now going to palpate your abdomen really quick. Let me know if you have any pain or tenderness, okay? Okay. No pain or tenderness noted, no masses noted, no bulges or hernias felt. I would now palpate deeper if there was any masses or pain noted. I would also go on now to check the inguinal area for any lymph node enlargement, as well as check for the femoral pulses. You're all good there. You go ahead and lower your shirt down. What I'm gonna have you do now is sit on the side of the bed, and we're gonna have you raise your pant legs for me, okay? I'm gonna just assess your lower legs. Okay, skin is intact. Skin color appropriate for race ethnicity. Hair distribution is equal. No prominent veins, superficial. I'm just gonna feel your legs really quick. Let me know if you have any pain or tenderness or any like that. Okay, no pain or tenderness noted. I'm just gonna check for edema really quick. Okay, no edema present either. I'm gonna check your posterior tibial pulses real fast. Okay, posterior tibial pulse is regular, +2, and bilateral. I'm gonna check your dorsalis pedal pulse too now. Dorsalis pedal pulse is also regular, +2, and bilateral. And I'm just gonna check for capillary refill in your toes real quick. So I'm just gonna squeeze your toenails real fast. Okay, and capillary refill in the lower extremities is less than 3 seconds. You're all good.